Hi, my name's Adam and I'm here on behalf of Umps Health, and I'm here with my team members Sarah and Joe, who are sitting down there, but I'll be delivering the presentation today. Humans at our nature, we're tribal people. From the dawn of civilization, we've lived in families, our families and with other families. And in every culture, in every society, and at every point in our 6 million year long history, it's been families that have taken care of us as we age. But if we look at the modern picture of aged care in Australia, it's the things that come to mind are nursing homes and old people's homes. This is the popular narrative. But we consider where the bulk of, this notion of outsourcing care and paying someone to take care of the elderly people is a very new concept in the context of our history. And if we look at who's actually still delivering the bulk of care for our elderly people in our societies, it remains families to this day. In fact, 1 in 8 people in Australia is an informal carer providing assistance to their family member. That's nearly 3 million people. This proportion is similar here in the UK, which means that 6.5 million Brits are taking care of someone that they love and helping them to live their lives. These people are husbands and wives, sons and daughters, and parents. In Australia, these people collectively provide 1.9 billion hours of unpaid care a year. And if we were to replace that with paid care, it would cost more than $60 billion. And that's 3.5% of Australia's GDP. It's therefore worrying when I say to you that for the first time in history, Australia is facing a shortage of informal care, driven by the double whammy of a massive increase in demand for informal care, as well as a shortage or a decline in the supply of informal care. There are several reasons for this, but these are the 3 main ones, and these are ones that I'm going to talk you through today. Last year, Deloitte released a report that stated that over the next 10 years, the demand for informal care in Australia will increase by 40%. And if we apply this figure to the 1.9 billion hours of care currently being delivered, that means an additional 760 million hours of unpaid care each year. So why is this happening? Well, Australia over the last century has experienced a huge increase in life expectancy, just like nearly every other country. And while we've gotten better at extending our lives, we haven't managed to solve the key chronic diseases that plague us in older age. Things like cancer, heart disease, lung disease, and dementia is the big one. Unfortunately, one of these is going to get all of us. And while it might not kill us, it will leave us in states of disability and more reliant on our family members for care. So who are the carers? What do they look like typically? Well, a typical primary carer is delivering more than 20 hours of unpaid care a week to their family member. The average age of a carer is 56 years old, so a lot of these people are approaching retirement age themselves. And overwhelmingly, 2/3 of these carers are female. So what we've got here is a significant level of dependence on a specific group in society, and we are maxing them out. Women today are working in paid care, in employment, at greater levels than they've ever been doing before. And more time spent in formal employment means less time available to deliver the informal care role for family members. The research shows that a typical carer, a 56-year-old woman who in 10 years' time will be 66 years old, is going to face age-related disability themselves. And so in 10 years' time, lots of carers will become care recipients themselves. But this is just a demographic profile. So if you think about the statistics at a personal level, about the needs and the challenges of individual carers, they're even more revealing. 40% of carers, of those 3 million people in Australia and 6.5 million people here, are suffering from depression. And that's driven primarily by the complete breakdown in their social connectedness that comes with this responsibility of delivering informal care. 2 in 5 carers have put off medical treatment to fulfil their caring responsibilities, and almost half have opted out of the workforce, placing carers at a significantly greater risk of financial insecurity. So if we look at this picture here, we can see the interconnectedness between these factors. A great increase in demand for care is placing a significant burden on a specific segment of society. This is having health implications and putting them at risk at financial insecurity, and that segment of society will not be able to deliver the care required into the future as demand increases. So, what are the solutions to date that we've focused on? Well, in Australia, financial support is offered to carers with the intention of supplementing paid income to allow people to deliver more unpaid care. Respite care, case management, counselling and carer support groups are delivered by public and private industry with the intention of building a support group around carers to try and alleviate those mental health issues. Education and training is available to try and increase the skill set, and that's delivered face-to-face or online to make carers more effective at delivering care. And there are options to supplement informal care with paid care, as well as carer support tools. These are things like remote monitoring, access to remote information, and remote care coordination tools. But what we see is that if we consider the solution landscape here, what we see is that there's an overwhelming focus on solutions that sustain the existing carers, sustain the status quo, sustain the system that has a dependence on informal carers. Standing too far away. Whereas solutions that decrease the dependency on informal carers come secondary. If we map the solution landscape to the problem landscape, we can clearly see a gap. Current solutions take an old world approach. They build upon this reliance of informal carers to deliver the care, and they're typically aimed at solving simple problems that are targeted at the individual carers to allow them to continue to provide care. However, if we take more of a systems approach and consider the systems that these are operating in, we can see that these solutions do not challenge the status quo. They do not challenge the approach that the systems that are built around the dependence on informal carers. And thinking of Cheryl's presentation, there are things like the regime. So there are regulatory systems, there are business service models, there are policies in place that emphasise informal carers. And then there's the landscape, the actual mentality that we've got in society of the way that care should typically be delivered. But we need to challenge this status quo because we need to tackle the current process that. Sorry, I just grabbed a glass of water. We do need to tackle this status quo because simply throwing more government subsidies, throwing more carer support, throwing more counselling at informal carers is not going to build capacity to address this demand. We've been thinking about how we reduce the reliance on informal carers for some time now. And personally, I've been thinking about the skills and experience and professional networks that I have to implement change in this area. I've also been thinking about the people that I need to involve in this, and that's not just my team, but it's also the collaborations that we need to make an impact and a dent on this problem. And I've been doing that because this is a problem that's personal to me. This is a picture of myself, my dad and my grandpa. And over the past 12 months, my grandpa's become increasingly frail and had a number of falls in his home. On one occasion, he wasn't found for hours. In response to this, my family's had to increase the monitoring of my grandpa to around the clock. That's included visiting him or calling him every day, but this very quickly became unsustainable. While doing this, I was working with an energy provider, developing a home energy management system designed to help people manage their appliances remotely using a smart plug. And that's when it hit me. My grandpa drinks a lot of coffee. So I got one of these smart plugs and I installed it on his kettle and programmed it to send me an SMS every time he used it. And this worked really well for my family. We received a notification 8 to 10 times a day telling us that he'd used his kettle, and that he was okay. After talking about this with friends, I received a number of inquiries, and this motivated us to apply for the University of Melbourne's Social Impact Accelerator. And we were accepted into that in July of last year. Since then, we've established collaborations with clinicians, with home care providers, and with government service providers as well. And we're looking to implement a commercial deployment later this year. So this idea that was never meant to be a business now has the opportunity to affect the lives of thousands of carers by providing them with peace of mind. Now, we realise that this solution isn't a panacea, and it's not going to address all the problems that carers face and all the problems that older people face. We recognise that we operate in a solutions landscape and a problem landscape that is shifting. But right now, we've identified an us-shaped hole where we can create impact for carers. And now it's about us growing into it. Thank you.
Thanks, Melvin. You can stay up there. We're going to hear for a couple of questions from our judges. Feels a bit like a beauty pageant. Thank you, Melvin.
I need a sash.
Hey, one of the things that was in your submission materials that didn't make it into the presentation was a really in-depth analysis of those two buckets that you showed of solutions that are targeting basic support for caregivers, and then the solutions that are targeting reduction of the need for care. And I would love for you to elaborate a little bit on that analysis and then how you got to those two buckets, the categories of those two buckets.
Yeah, so support for carers and reducing the need for care. Yep. Well, this was taking kind of the approach of the two sides of the same coin, starting with the shortage and thinking about the supply side and the demand side. A lot of solutions currently are well-intentioned to be designed to support older people as they age more independently. And that's driven by a desire for older people to remain in their homes for longer. When we analysed those solutions, what we found was that there are a number of issues with the way that companies or businesses had come to develop them. A big one was that technology companies weren't engaging with older people early enough in the design process, didn't have a real good understanding of the needs and wants of older people, and that's kind of consistent with how older people are treated in society more generally. They tend to become a bit more invisible, a bit more generic. People don't consider the intricacies of older age. And so in my grandpa's case, for an example, he had a piece of technology that was designed to detect his falls. That's a pendant that's worn around the neck, but it relied on him to completely change his behaviour, to wear the pendant. When he fell, he had to want to press the pendant. He perceived that pendant as a one-way ticket into residential care, so even when he fell, he didn't press the pendant. And that was a common story throughout a lot of the technology that we analysed on that side. And it's actually that was actually one of the driving motivators for me designing my solution, because it doesn't rely on him to change his behaviour. It wasn't until we began engaging in this program that we realised the scale of the informal care market and the fact that the real benefit of some of these of our solution is actually to aid carers in having a greater sense of peace of mind. Lots of carers deliver 20 hours of care per week, but lots of them are also still working full time. And so that's when, and also in our business, a lot of the purchasing power often resides with the carers as well. And so that's when we started considering solutions to actually aid carers, and that's how we came up with those two buckets.
Hi, I'm curious to learn about some of the other kinds of solutions. It sounds like technology that doesn't require behavior change is one. So what are some of the other solutions you would prioritize in this market?
Yeah, so if I think about the when I think about the market, we'll focus on the informal carer first. So it doesn't require behaviour change of the older person, and therefore it functions better and supports the informal carer. The other big solution that I would focus on developing, and we have a technology background, but the service landscape for aged care provision in Australia is very complex. It's very fragmented. There are a huge number of providers providing all of those solutions up there. And as someone who is witnessing the decline physically and sort of mentally of someone you've always looked up to, then having to deal with all the day-to-day challenges and navigate that whole service space, that's something that we repeatedly saw was a huge challenge. And so I would focus on making that easier to navigate, developing a more sophisticated care coordination tool that worked better for informal carers.
Fantastic. Thank you so much.